Whelan Presley Funeral Home and Crematory, a proud supporter of WQPT, has been serving Quad City families since 1889. They now have live stream capabilities for viewing your loved one's funeral or memorial service.
At IHM VCU, we've always been here for you. You are and always will be our top priority. We care about your financial and physical health, and we are here. IHM VCU is a proud supporter of WQPT.
The latest COVID surge and its impact on our kids, and carting around the streets in high speeds in the cities. Many thought the COVID pandemic was safely in our rearview mirror at the start of the summer, when there were very few cases being reported locally, even though we heard of different coronavirus variants being seen elsewhere. But all that has changed as the summer comes to an end. Cases are rising, hospitalizations are becoming a bigger worry, and younger children are seeing more serious symptoms. Throughout the pandemic, local health departments have tried to be straight shooters when it comes to COVID-19 and its impact, and we talked with Rock Island County Health Department's Janet Hill about the latest concerns. Have we plateaued? I mean, is it one of those cases that even that the Pfizer vaccine has gotten FDA approval, that people are just going to say no?
We have definitely seen an uptick in vaccination in the last couple of weeks, especially since Monday when the FDA did give approval to the Pfizer vaccine. You know, we're very worried about the kids who are too young to get vaccinated. You know, and many of those people are who are not vaccinated are the parents of these kids that are too young to get vaccinated. And I just don't understand, if you're a caring adult, you want to protect people who can't take care of themselves. And in this case, that's our kids younger than 12.
Doctors are saying that they're seeing the symptoms in kids worse than last year. In other words, the original COVID-19 had an impact, of course, on seniors and adults, but these Delta variants and other variants seem to have a greater impact on kids.
You know, we heard our healthcare partners in a call last week talk about how they are having trouble taking care of the kids. They want to get them to children's hospitals, and those children's hospitals are full. And I think that just shows that the Delta variant is so much more contagious and really is a different situation than we were facing a year ago.
When you look at the statistics of cases in our area, you just see it start growing after the 4th of July. A kind of a late summer into fall surge. Now you got classes that are all in place right now in schools all across the area. Do you think this surge is just going to continue?
I certainly hope not, because we are seeing more people come in for vaccination, and we really hope that the formal FDA approval that came on Monday for the Pfizer vaccine will give people that final push that they may need to get vaccinated. I mean, we need to remember that we've been dealing with this for a long time, but vaccination is not new. So this is something that people have been doing for decades, if not hundreds of years. So this is not a new process. We just need to get people to understand that this is a safe and effective vaccine.
We're also seeing businesses and schools and hospitals and healthcare centers mandating that their workers get vaccinated. I mean, do you think that's going to help the situation when you're actually seeing more vaccines being given right now?
I think that's very possible. I mean, the governor says that anyone, a teacher or a staff member at a preschool through 12th grade school, a college or a university, personnel and students, healthcare workers, I think that will increase the number of vaccinations. And when we increase number of vaccinations, that means the virus will not duplicate and there will be fewer infections in our community.
Talk about Illinois for a second, too, because the governor has now mandated mask wearing starting on Monday. I mean, you welcome that, I'm sure, because you keep pointing out social distancing, mask wearing, washing your hands, all of those go a long way to stopping the spread of COVID.
That's right. We know that masking and social distancing work, because before we had the vaccine, we were able to keep infections down with just those two interventions. Now we have a tool in the vaccine that, coupled with masking and social distancing and hand washing, will definitely decrease the number of cases.
We have, as we're talking about the schools opening, I mean, I know Iowa schools just opened, of course, and a lot of the Illinois schools opened in the middle of August, but Rock Island Milan opened at the beginning of the year. They always seem to be the guinea pig, is that people see, okay, how does Rock Island Milan get along? So we're about a month into the school year for them. Did you notice any uptick? Is that like an area that you also keep an eye on as Rock Island Milan School District?
That's right. You're absolutely correct that the cases in children started building over the summer. And now we do have kids in school, and everyone agrees that having kids in school is best for learning and the social emotional health of kids, parents, and teachers. We understand that quarantine is disruptive, but vaccinated kids don't have to quarantine, even if there's an exposure. They only have to quarantine if they are symptomatic. So again, the simple solution is to get vaccinated if you're old enough to get vaccinated, and if you have children who are not old enough to get vaccinated, to do it for them to help build a bubble around them at home.
What are you worried about as we head into the fall season? Because it's also the flu season. There's more respiratory illnesses coming in September, October, November, into the winter. I mean, it just seems to be a bad mix.
That's right. We had a big push for flu vaccine last fall, and it worked because in Illinois, not every case is counted. It's only counted if someone dies or if someone is hospitalized in the ICU. In the entire state of Illinois last year, there were 11 people hospitalized in the ICU. So this to me proves that vaccination, masking, and social distancing work.
Yet it's been politicized. I mean, let's be honest. I mean, you've been in public health for a number of years. We've talked about so many different health issues over the course of our conversations, you and I. And over the last 18, 19 months, COVID has been basically the only issue we've talked about. And yet, you could tell that there's people that just say no masks, or people that say there's got to be masks. And it almost seems to be a red-blue type of fight.
I think that you're absolutely right that it has become that. It's really upsetting to anyone who cares about people to see that. I mean, it is, love your neighbor. It's a pretty basic concept that you wear a mask, you get vaccinated, not only to protect you and your family, but to protect your community. A healthy community, economically and socially, needs to have its health physically at the forefront, and that's how we do that with this particular pandemic, is we vaccinate to protect all of us.
Well, let's talk about the very beginning of the year, because when you took over the Camden Center and the military's there, and you're running it like clockwork, and you have hundreds, if not thousands, of people being vaccinated during the early springtime, then your next phase seemed to be get out. You went to the schools or the churches or the community centers and tried to convince people to get the vaccine there. What's your next step? Haven't you run out of options by now?
Well, at this point, when we had the Camden Center and the TaxSlayer Center and the auto auction before that, vaccine was not readily available. The health department was, one of your main sources throughout each community to get the vaccine. Now it's practically on every corner. You can go to vaccines.gov, you can pick the vaccine that you want, and you can find it as close to your house as just around the corner. With the push from public health and with our healthcare and pharmacy partners, there's plenty of opportunity to get vaccinated.
You have been working really with high-risk people in our community right now as far as the booster shot, the third shot of the Pfizer vaccine. What do you think the progress is for booster shots for everyone else?
President Biden talked about that earlier this week, saying that he expects to have boosters to the general public starting at the end of September. But it'll be a metered response, just like it was at the beginning, because the booster shot will come 8 months after your second dose. So it'll be the healthcare workers, the teachers, the frontline essential workers, the older residents who will get it first, and then we'll get to the general public. And we are working with our partners who have been so good to us throughout the pandemic to perhaps set up some mass vaccination clinics. We will continue to do it here at our health department on Tuesdays and Fridays. Walgreens, CVS, Hy-Vee, Jewel, etc. will continue to do it. There'll be plenty of opportunity for people to get boosters when it's time. In the meantime, we can't forget that we do have interventions that do work. And if people who are waiting for their booster shots can continue to mask and social distance to prevent some infection.
Do you expect like a big, I don't know how to say this, a big rush of people, I guess, to get the booster shots, only because you had that big rush of people getting their first and second doses? You know what I mean? Is the timetable's the same. The same people that really all stood in line back in, March, April, and May are now going to be wanting it 8 months, 9 months later.
Yeah, we are expecting a big rush, but the difference this time is it's just not the health department offering it. They won't have to, wait in long lines or, work their way through a registration process. It should be readily available because there is a lot of vaccine in our communities.
Let's talk about some of the other issues that the health department does face. I mean, you've been really active as far as helping mothers and children and their health as well. Are you worried that with COVID that other people aren't taking care of themselves in other ways, I guess I'm saying?
I do worry about that. When I'm not dealing with COVID, I lead the maternal child health team at the health department, which includes WIC and some associated programs. And we are seeing mothers who are just at their wits' end. They're trying to work, they're trying to keep their kids safe, they're trying to just do everything that they possibly can. And the pandemic makes it so much harder. So I am worried about, the mental health of our moms and our fathers who are taking care of kids. I'm worried about the mental health of our children. We know that they need to get back to school for everyone's sake, not just a child's sake, but the mothers, the fathers, the teachers. It's best when kids are at school, and we are worried about that, definitely.
Because I'd be worried also about the anxiety level, because people have been anxious now, since March of last year.
Right.
I mean, that takes a toll when it's this long of a pandemic and this much anxiety for such an extended time.
We do depression screenings on our prenatal and postpartum moms, and our scores have been a lot higher since the start of the pandemic. We are working very closely with our mental health partners to make referrals. And, on our coalition calls, we hear leaders of healthcare or mental health care organizations say that their patients are at their wits' end. I mean, this is a really stressful time, and I hope that people get the resources that they need.
Janet Hill with the Rock Island County Health Department. Still ahead, bringing the go-karts back to the cities as the Labor Day weekend roars back to life. It's just one of the things you can do if you go out and about. And here's Laura Adams with even more ideas.
This is Out and About for September 2nd through 9th. The world's largest professional go-kart street race, the Rock Island Extreme Grand Prix, takes place September 4th and 5th, followed on the 6th with the Rock Island Labor Day Parade. Or celebrate at Walnut Grove Pioneer Village for their Labor Day Festival on the 5th. The Cedar County Fairgrounds in Tipton, Iowa host the Good Makers Market the 3rd and 4th, plus the Doric Lodge Kids Fishing Derby takes place the 4th at Sunset Marina. Check out the Illinois State Horseshoe Tournament at Riverside Park in Moline the 2nd through the 5th, or catch Muskapalooza, a 2-day music and art festival in Muscatine on the Mississippi the 3rd and 4th. Free concerts include Thursday Night Groove at Schwiebert Park the 2nd and 9th at 7, Bass Street Landing's Thursday Concert Series at 7, the Live at 5 free concert series at RME, and Mercado on 5th Fridays in Moline. Jumer's Casino present Marshall Charloff and the Purple Experience the 3rd, and Rhythm City Casino present the Little River Band the 4th and George Thorogood and the Destroyers the 5th, while the Moonlighters QC perform at the Riverside Casino in Riverside, Iowa on the 4th. On stage, you still have time to boogie down to Circa 21 to catch the musical Saturday Night Fever, and opening September 9th, The Guys at the Black Box Theater honoring the 20th anniversary of 9/11. For more information, visit WQPT.org.
Thank you, Laura. Jason Carl and the whole damn band got a chance to show off their inner Beatles in August as they performed at the Abbey Road concert at Schwiebert Park in Rock Island. But before the pandemic, Jason hit the stage of the Black Box Theater in downtown Moline to perform one of his own originals. Here's Jason Carl with Crazy Life.
thinking you should and know when you could. Timed it just right and you're feeling pretty good, but you're wondering if it would be alright. With nothing to hide, it's easy to decide. Just move on over and have a look inside, but you're wondering why your mind is so uptight. And I'm spinning around in my chair, but I just can't get you over to my side. There ain't no rules in there. It's a box your brain is in. It's a picture painted in your mind. Nothing to lose but an old pair of shoes. You can run around this world almost any way you choose, and as long as things improve, you're doing fine. Keep moving ahead, making some bread, saving up a little like your old man said, with a pillow underneath your head every night. I'm spinning around in my chair, but I just can't get you over to my side. There ain't no rules in there. It's a box your brain is in. It's a picture that's painted in your mind. And no one will say what's going on today. The real world ain't real no more. It's standing in your way. I take experience over pain every time. You gotta take another look. It ain't written in a book. You can get anything you want. Just talk directly to the cook. And as long as all that took sure flew by. And I'm spinning side. I said there ain't no rules in there. It's a box your brain is in. It's only a picture painted in your mind. Keep moving along through an ever-changing song, where you gotta do something before you're doing something wrong. And when you're living on the edge, it's a long, crazy life.
Jason Carl with Crazy Life. It was another casualty of COVID in 2020. The Extreme Rock Island Grand Prix go-kart races are a tradition in the heart of the district, and the races are back again this year with something different. We talked with race organizer Roger Ruthart. Roger, you had to cancel last year. That'd be a tough decision, but it makes this year even more sweet, doesn't it?
Yeah, it does. Honestly, this year is probably the roughest year that we've had in terms of preparing for the race, because when you have an annual event and you skip a year, it's actually been 2 years since you did it. And so, you know, we've had to sort of start over in a lot of cases in terms of volunteers and sponsors and racers and, you know, the community and everything else. So, you know, it's been a challenge. We have a great organization and, you know, we've gotten through it, but it's been a lot of, you know, toil and trouble, you might say.
Yeah, and I never really thought about that, because you get into a rhythm with volunteers and everything else, and when that rhythm is disrupted, it would be tougher to start again. But it seems like this year you've added a few events to make it more of almost more of a festival down in the district area on top of the races.
Yeah, I think that's something that we saw as a priority. We went into a partnership last year with the National Karting Alliance, which we're trying to transition into them taking over all the racing aspects of the weekend. And our organization just can focus on, the excitement that goes around it, and things like announcing and music and ancillary events and things like that. So there's a lot of that more this year. We've really, focused on trying to add some things, not only to get more people to come down, but also, if people come down, they don't want to sit and watch people race that they don't know who they are for 5 hours. They can come down and watch for a while and then go do something else and then go watch a little bit more. And the longer we keep people downtown, the more the local businesses can benefit and things like that.
Well, the Extreme Rock Island Grand Prix really has matured. I mean, it's been around for more than 25 years. Tell me what it means to the go-karting industry. This is a race that's really put Rock Island on the map.
Yeah, it has. Motorsports is motorsports, and there's a lot of blurred lines. You see drivers jumping between, different series and everything. So, we've had a lot of drivers who've successfully gone on from racing and karting to racing in major, NASCAR and IndyCar and things like that. And at the same time, there's a lot of people who this is just their thing, and they've done it for a lot of years and they're very good at it, and probably actually better than some of those other people that ended up with a higher profile name.
And they like to come to Rock Island. I mean, there are other go-karting races, but this seems to be the daddy of the races in some ways.
Well, Rock Island is a special place. Not only event, but also the town. I mean, a lot of these racers, what they do week in and week out is they go to a kart track that's, outside of town or in the middle of a cornfield or something and race, and their mom and dad and their girlfriend maybe watch them. And so this is the race that everybody, they have the family reunion, they bring their sponsors along, they bring their friends and, sort of make a party out of it. And downtown Rock Island is a good place to do that.
The other thing is that, I mean, you have different winners, it appears, each and every year. I mean, you have some people that return and win again, but it's like it's anybody's game each year. It's nice that not one team dominates and that you just sit there and go, oh yeah, Team X won again. I mean, you've really got a wide variety of potential winners out there.
Yeah, again, this is kind of a special race in that respect, in terms of the difficulty of the course. You look at the course and it's, it doesn't look very difficult. It's kind of an L shape with one right-hand corner. And a lot of these racers race, on tracks that have 12 or 15 turns in them. But the difference here is that, sometimes you're racing on asphalt, sometimes you're racing on concrete, sometimes you're in the sun, sometimes you're in the shade.
Yeah, very true.
You have to go over the brick crosswalks. There's all kinds of different things that these racers don't face on a week-to-week basis. So that makes, coming here, a bigger challenge.
Yeah, because they are so low to the ground, and you can see these go-karts when they're going over the sidewalks, the brickwork that's there, or even the manhole covers. I mean, it could be a challenging course, even though, as you said, it's not that complicated as far as turns are concerned.
Yeah, it's just picking your way around it in what is, the most manageable and fastest way to get there.
I ask you this each and every year. Where should a spectator go? Where's the best place to see the best part of the race?
Well, I mean, it all depends on what you're interested in. The start-finish line is always great. We have some bleachers there, and the starts are exciting. The finish is always exciting, especially for the drivers. Some of the races, turn one, when you have 30 or 40 carts trying to make it through the first corner, they haven't sort of spread out around the course yet. That's a good spot sometimes. Also, I like the center of the track by Circuit 21 and through there, where you go through the right-hander and then the left-hander, and there's some shade down there, so if you don't want to sit in the sun all day, you can sit in the shade, and that's a pretty tricky part of the course. It's a real short section, and then it goes back into 18th Street, which has a crown in the road, so that's another challenge that some of our streets offer and others don't. So, that's an interesting place too. It's really, I guess if I was going to give some advice, I'd say walk around and experience it from every different angle. And, be sure and visit we have a lot of interesting activities and exhibitors and things like that that are just as worth visiting as the races.
Roger Ruthart with the Extreme Rock Island Grand Prix. On the air, on the radio, on the web, on your mobile device, and streaming on your computer. Thanks for taking some time to join us as we talk about the issues on the cities.
Wheelan Presley Funeral Home and Crematory, a proud supporter of WQPT, has been serving Quad City families since 1889. They now have live stream capabilities for viewing your loved one's funeral or memorial service.
At IHM VCU, we've always been here for you. You are and always will be our top priority. We care about your financial and physical health, and we are here. IHM VCU is a proud supporter of WQPT.